Hello, my name is Scott Willis, and I'm here to discuss with you about a teaching opportunity that I was afforded at my place of employment. I spoke with coworkers about the importance of functional assessment training. My presentation goals going into it, first and foremost, my vision is to inspire others to function at their best at all times. Not only does that mean physically, but also mentally, emotionally, and all across the wellness spectrum. My guiding principles are always to be educational, functional, and inspirational. The learning objectives for my presentation with my coworkers was first to allow them to understand the purpose of functional assessments. Second, to realize the potential risk factors that one may face throughout a movement analysis. Third, to recognize that each individual that we come across will have their own specific needs that need to be addressed through an exercise assessment. Be able to conduct a functional assessment based on those individual personal goals that a client may have. And finally, to identify SMART goals for future attainment. Breaking down these learning objectives further, I wanted my coworkers to understand why we perform functional assessments. The why is very important. Second, I want them to understand what an individual's limitations or weaknesses may be before we move into an exercise protocol. An individual may be limited through a certain movement deficit or by a prior injury, and so we need to know that as a professional before we were to create an exercise program for that individual. Third, we need to understand that individuals are exactly that. They are individual. And while assessments can be used over and over as metrics, we need to understand that not all tests are appropriate for each individual. Next, personalized assessments can remain constant, even though they are tailored for the individual, meaning that we can retest those individuals with the same assessments after we've decided which assessments are appropriate for the individual. And finally, the SMART goals stands for specific, measurable, attainable, relevant, and timely. Specific: who, what, when, where, why, and how. We need to be able to answer these questions when creating goals. Measurable: we need to have goals that are quantifiable in some fashion so that we can measure our success or growth on our way to completing that goal. Next, the goal must be attainable, meaning how much effort, how much time, how much money, and how much talent is required to attain that goal. The goal must be relevant. Is it a building block for something future, or is it just something that the client decided they wanted to do? Is it something that their doctor has asked them to do? How much relevance is there for that individual? And finally, goals must be timely. We must choose realistic goals, and they must be flexible as well, understanding that things happen in life and we may not always be able to move in the exact timeline set forth. We may need to expand the timeline. We may need to halt the timeline and pick it back up at a later point in time. The purpose of functional assessments is A, to identify risk factors. Certain individuals will have inherent risk factors that can't be overlooked, and other risk factors may be modifiable not only through the assessment process, but also through an exercise protocol. We need to be able to identify an individual's movement deficits. We do this through a biomechanical assessment. We also need to be able to identify which exercise variables are appropriate for each individual client, and this leads back to the personalization of each functional assessment. And finally, we need to be able to identify future goals. We need to be able to plan for the future. This typically takes place at the end of an assessment. However, you may find this towards the beginning of an assessment when the professional is looking at deciding which physical assessments and which questions are most appropriate for that individual client. I work at Fitness Together. It's located in Brecksville, Ohio, and we use a program called Trainer Metrics. This Trainer Metrics is a website, and it is a fitness testing and client data management software system that allows us to compile all of our clients together under one roof. We can access it from any of the iPads and laptops around the gym. We can access it at home if we're writing programs, and we can share it with our clients so they can see their growth. It allows us to graph certain metrics, and it allows us to see charts for future progression or to categorize them based on certain metrics that they've achieved during testing. The components of a functional assessment that I'm going to discuss today includes basic data, internal health, body composition, cardiovascular health, biomechanics, strength, endurance, and power. Not all of these components will be used in every single functional assessment. However, very many of them will be. Not all are necessary, not all are appropriate, but you will typically find some aspect of a majority of them in each of the assessments that you will conduct with your own clients. Basic data. So we're looking at weight, height, age. Those three together will allow us to, specifically with the weight and the height, will allow us to determine an individual's body mass index, or their BMI. The age will help us categorize them into a percentile. And then from there, we can also determine their resting metabolic rate. The great thing about Trainer Metrics is it will actually do this calculation for us along with the BMI, and will show us which percentile our clients land in based on their age. Resting metabolic rate is the rate at which the body burns energy when it's at complete rest, and this is important when determining future exercise protocols for a client who is potentially interested in losing weight, or sometimes for clients who are interested in gaining weight in muscle mass. We need to understand their metabolic needs so we can determine if they may potentially need to be at a caloric deficit or at a caloric surplus. Body mass index, here's a chart for it. When we're looking at it, BMI is a standard measurement for males and females. However, it does not account for muscle versus fat. So muscle weighs more than fat. And so when we're looking at a person who's extremely lean, their BMI may read higher than a person who has a high percentage of body fat. And so, as you can see by the chart, there's no classification for lean or extremely strong or fit in any aspect. It goes from underweight down to into the obesity classes. And so that is one of the fallbacks or limitations to using body mass index exclusively. When assessing a person's internal health, we're typically going to look at the resting heart rate and the blood pressure. Resting heart rate can be taken at the radial pulse, the radial artery in the wrist, and typically you're going to measure this for 60 seconds. If you wanted a quicker way, if you were in a pinch, you can take it for 15 seconds and multiply by 4. However, 60 seconds is typically the safest way. You can also may be able to identify if someone had an irregular heartbeat in a resting state, and this may be cause for prescribing a doctor visit in the future. Blood pressure, you will use a sphygmomanometer in order to be able to hear the arterial pressure, and you'll also double this with a cuff. So the cuff is going to go over the bicep, and you'll pump the cuff up. And so as you decrease air pressure out of the cuff, when you first start to hear the heartbeat, that is going to be your systolic blood pressure. This is the top part of the chart. So you're looking for, in a normal range, around 120, maybe a little less. Anything over 120 will start to be elevated. And then as you continue to let air pressure out, the last bit of heartbeat that you hear will end up being the diastolic blood pressure. And this will be the minimum heart rate. The second number, typically, you'll hear a certain number dash and then another certain number. And normal is going to range right up to about 80. You're looking to be a little bit lower than that. Anything above 80, if you lose it a little earlier than that, it's starting to get into that high blood pressure range, and we want to avoid high blood pressure. A person's body composition is also very important to note, specifically for those who are looking to gain and or lose weight. Many times in a gym, people are falling into that second category, losing weight. So your girth circumferences are going to be used as an objective measurement to be able to detail how much weight they are losing outside of the second one that I'll discuss next. Bioelectrical impedance is their body fat percentage, or we'll measure that. So girth measurements will typically take place at the neck, the shoulders, the chest, the waist, the hips, left and right thigh, left and right calf, and left and right biceps. In doing so, we can then track as a person starts to lose their body fat, overall body fat, not just percentage. We can track and determine which areas of the body are losing and which areas of the body are still holding on to it, the trouble areas. Bioelectrical impedance, on the other hand, will measure our body fat percentage. So a person with a higher body fat percentage is going to obviously have more fat cells. Fat is it will impede electricity. Bioelectrical impedance is essentially pumping electricity into the body. So the more fat cells the body has, the less distance that electricity is going to get into the body, or the more resistance the electricity will have to spread through the body. The less that the electricity is able to spread, the higher the number is going to read. One limitation to bioelectrical impedance is hydration status. If an individual is dehydrated, it will limit the test because, again, water is a conductor. So if the body is properly hydrated, the electricity will be able to run through the body with less impedance. Whereas if an individual is dehydrated, even if they don't have quite as high of a body fat percentage, the machine may end up reading their body fat percentage to be slightly higher. Bioelectrical impedance, as you can see here, there are two different charts, one for males and one for females. And as you may be able to notice, males do have a lower acceptable percentage of body fat at each of the categories compared to females. And this is due to females having reproductive organs that tend to require a little bit more padding and protection than males have. Moving on to cardiovascular health, when you're assessing individuals in the gym, you're going to be looking at a couple things: the resting heart rate, an individual's VO2 max, and then a exercise protocol that we can take them through is also the 500-meter row. Looking at the resting heart rate, normal range is going to be between 60 and 100 beats per minute. This will tell us if an individual's heart rate is pumping properly, not working overtime to get blood through the body. If a person has a higher resting heart rate, it means that the heart is just constantly working to get blood pumping through their body and is not being very efficient. The VO2 max refers to the maximum amount of oxygen a person can utilize during intense bouts of exercise. So at Fitness Together, we utilize a 5-minute fit test where the incline will gradually increase as the 5 minutes moves along at a steady pace. And so as an individual's heart rate goes up, we will be able to determine, based on metrics that the treadmill provides us with, what an individual's, or roughly what an individual's VO2 max is. If a person is looking to increase their endurance and or lose body fat, we can use the VO2 max to start to prescribe cardiovascular exercise and then use this as an objective measurement moving forward. And finally, the 500-meter row time is an objective physical assessment that we can use, and we can determine based on improvement or any type of faltering of metrics with the overall time to get to 500 meters during the row, how an individual is progressing through their cardiovascular health. This also will show us a little bit of muscular endurance, but it's not an accepted muscular endurance exercise assessment. Moving into biomechanic assessments. Biomechanics are very important because we can find issues here that may lead us to corrective exercise. There's a couple different things that we can use to assess an individual's biomechanical deficits. The first is the sit and reach. The sit and reach allows us to determine their hamstring and lower back flexibility. So how the erectors work in the low back. If they're tight, they're not going to have very good flexibility. They're not going to have a great number here. If their hamstrings are tight, it's not going to allow their pelvis to anteriorly tilt and reach forward for their toes. So this is one thing we can look at. The second would be an overhead squat analysis, and I'll get into on the next slide some deviations that we'll be looking for. But essentially the overhead squat is used to find symmetry in the body. It is also used to find muscles that are tight and or overcompensating, undercompensating compared to their counterparts. And finally, the functional movement screen, also known as the FMS, is comprised of 7 tests, each of which are scored on a 0 to 3 scale, which for the most part test dynamic stability, mobility, and functionality. And I will get into that in future slides as well. So stepping back to the overhead squat, here we can see the various deviations that may occur. As we look into this, this is also very important in anterior cruciate ligament risk. There's plenty of injuries that we may be able to determine due to an individual's deviations, but specifically looking into knee health, we can see from the anterior view that if the feet turn out, if the knees move inward or outward, these are all deviations. Specific to the ACL, if the feet turn out, there's a greater risk of the thigh internally rotating, which will also coincide with the knees moving inward or moving into a position of valgus. And valgus and internal rotation of the hip are 2 of the greatest risk factors that an individual may face when determining inherent biomechanical risks for non-contact ACL injuries. As we look at the lateral view, an excessive forward lean is going to tell us that a person's latissimus dorsi are tight, and if the low back arches, we know that they have really tight erector spinae muscles. If the low back rounds, they have either overactive hip flexors or a weak back. We're looking for a straight line from the shoulder blades all the way down through the PSIS in the pelvis. And then if the head falls forward, we know that either they have an extremely tight set of anterior neck muscles or posterior neck muscles are very weak. And again, we're looking for an extremely straight spine here. You can notice that the hands do or should sit just posterior to the base of the skull, and this will give us proper range of motion in the lats. Again, if the arms fall forward, the lats are tight. And looking at a posterior view, it should look as though the individual is sitting backwards in a chair. They should have a relatively vertical spine. If their feet flatten or cave inward into a position of navicular drop, this is going to lead also into a knee inward position that I discussed from the anterior point of view. Typically, those two go hand in hand. If the heels rise, the individual's putting their weight too far forward. We want them to sit their weight backward into the hips. If their heels rise, they're going to be more quad dominant. Their glutes and their posterior chain aren't going to be absorbing as much of the body weight. And then from the posterior side, more so than the anterior, we should be able to see if there's any type of asymmetry in their weight, whether it's shifting left or to the right, and also in the shoulders. From the front view, sometimes the shirt will sag a little bit in front of them, in the shorts as well, and so we can have a little bit of a misreading if it comes to any type of asymmetry in a lateral position. But from the posterior side, as all the clothing tends to be tight to the back and to the hips, we can start to see where some asymmetries might be. So me personally, as I do this assessment, I like to look at the overhead squat, not only as a static position, having them hold that position, but also reviewing it as a dynamic movement. So I will take a video of the individual from all directions, left, right, anterior, and posterior, and I will frame by frame slowly scroll through the video and be able to see, more so in this type of video, if there's any asymmetries in their weight shifting as they go down, because by the time they get to the base of the squat, they may have actually centered back up, but there may be something in their hip or something in their knee that on their descent or on their rising out of that position, they may have some sort of compensation or deviation in there. So an individual scored based on the number of deviations. The goal is to have the least number of deviations as possible. A score of 0 is fantastic. The more deviations an individual has, the more the professional must work to correct these. And whether that is a matter of offsetting, stretching, and strengthening. Moving on to the functional movement screen, we can see here various tests that are available throughout this. There are 7 tests, as I mentioned. Each one scored 0 to 3. A score of 0, the movement was extremely painful. They most likely should go see a doctor. A score of 1, they were not able to completely perform the movement pattern, but it wasn't painful at all. They just either don't have the coordination or they don't have the functional ability to do that specific movement. A 2, they have the ability to do it, but there's some sort of compensation, whether there's a lack of stability, a lack of symmetry, a lack of mobility, but they're for the most part able to move through the movement screen. They would get a score of 2. And finally, a score of 3, they have an unquestioned ability to perform that movement pattern, and there will be no compensations that are visible to the professional. The 7 assessments: deep squat, hurdle step, inline lunge, shoulder mobility, active straight leg raise, trunk stability push-up, and rotational stability. A majority of them have to do with some sort of bilateral and or symmetrical functional mobility, stability, flexibility, and or range of motion. And the range of motion, the flexibility, the mobility tends to occur in a multiplanar fashion with all of these movement screens. When we're looking at strength, for the most part, we're assessing for maximal strength in this category. The next one, when we move on to endurance, is going to be muscular endurance. Muscle strength tends to be maximal strength. You will find sometimes a professional will use a 3-rep max instead of a 1-rep max. Personally, I don't like the fatigue factor of a 3-rep max, but some individuals may need that because a 1-rep max will just be too intense. When we're looking at the back squat, the barbell will sit across the shoulders, resting right around C7. You want to be able to pinch the shoulder blades together to create a shelf with the upper traps, and then you're looking for shin and back angles to be very similar. You want them to sit backwards with their hips and drive out of the hole, chest coming up to the ceiling, for a weight that is sufficient that only 1 rep can be completed. If more than 1 rep can be completed, you're looking to add weight to the bar and continue to go up until you can find that 1 rep maximum number. Same thing with the bench press. As an individual lays back on the bench, very first thing, you want them to act as if they're performing a row. So they're pinching their shoulder blades together. They're moving their elbows behind them as if they're trying to touch their elbows behind their back. And in doing so, they're going to bring the chest forward or up to the ceiling. This is going to do a couple things. First off, it will slightly round the back and rotate the pec majors into a position of maximum usage. It's going to allow the most amount of fibers to be engaged, and it's going to allow the pec majors to really come to the forefront. Second, it's going to prevent the rotator cuff muscles from really taking over. We want the weight to stay out of the shoulder to the best of our ability. We want to keep it in the chest and in the pecs when we're doing a bench press. If the shoulders are able to protract, if the shoulder blades are able to separate from the spine, the weight will actually fall into the rotator cuff muscles and cause a shearing force. Specifically, typically you'll see injuries to the supraspinatus if the shoulders are able to protract in this capacity. And finally, when we're looking for this 1 rep max of the bench press, by pinching the shoulder blades together and not allowing that protraction of the shoulder blades, we're going to take the serratus anterior out of the movement, and so we can get a better gauge of specifically how strong the pec major is, as opposed to other synergists that may be involved in the movement. Finally, deadlift. Deadlift 1 rep max is going to allow you to determine an individual's overall body strength. To me, it's the most functional of the 3 maximal strength exercises. It's slightly safer than the back squat, even though it's very similar mechanics, because you can always let go of the deadlift bar, whereas the back squat, the bar is on top of you. And so either you have to drop all the way down to your safety pins or work your way out of it. A spotter has to lift you up. Same thing with the bench press. The bar can land on top of you. Spotter needs to be there. With the deadlift, you simply let go. Great thing about it, it allows you to test your forearm grip strength. It allows your back to work in an isometric hold so that your shoulder blades can stay taut and tight. Your lats are activating, trying to bend the barbell in half. Posterior chain is getting most of the work. It takes a lot of the pressure out of the quads, which again, looking at anterior cruciate ligament injuries, when the quads overpower the hamstrings, you tend to land in a position of knee hyperextension, which places an individual at risk. Also, if the glutes are weak, the femur, the thigh, is able to internally rotate at the hip. And so we want to strengthen the glutes to the best of our abilities. The deadlift is a great exercise for that. Also for athletes, just an added bonus, the deadlift is the #1 exercise to increase ground reaction forces. So by testing an individual's deadlift 1 rep max, if you have any type of speed, explosion, power athlete who either needs to move their feet quickly or be able to get into a sprint quickly, the deadlift is going to be a great exercise to utilize for this. Moving into muscle endurance, we have 5 tests here, 3 of which are for maximum repetition, 2 of which are for maximum time. So when we're looking at the pull-ups, not every individual is able to do pull-ups, so we may need to modify this, whether you're using a Gravitron or if you have a cable system that you can hook straps across and have the individual place their knees on and give assistance to. If you're going to do it this way, you want to make sure you chart exactly how much weight you're using for assistance. So in the future, for at least the next 2 to 3 retests, you can use that same amount of assistance so you can determine how much stronger or how much growth is coming during that assessment. Eventually, if the individual becomes strong enough to do pull-ups on their own, you want to get to that base metric so that you get the most accurate results. But it may take many retests in order to get to that point, if they even ever get there. Pull-ups are going to test back strength. The difference between a pull-up and a chin-up: pull-up, you're in a pronated grip position, whereas a chin-up, you're in a supinated position. So the goal of the pull-up is to isolate more into the back. We want to take the strength aspect of it out of the biceps, because a lot of people are stronger in the biceps and they're going to be able to do more, but we don't get a good gauge on actual back strength in that position. So we're going to be in the pronated grip position. The width is really up to the individual. Typically, you're looking for a little bit wider than the shoulders, but it's more so up to the comfortability of each individual. When we're looking at maximum push-up repetitions, push-ups are a great functional exercise. Really works the entire body. As you're getting into the down position, your lats are going to activate as the elbows come back towards the ribs, and then as you push and drive out of that lower position, not only are the pecs working, but also the deltoids, the triceps, your anterior, serratus anterior, and then the muscle groups that don't get thought of very often. You're in a plank position, so your core is working. It is functional. This goes back to one of the functional movement screen assessments in the trunk stability. You also are going to get a little bit of quad hip flexor strengthening as you're looking through. They tie hand in hand with the core there to keep your hips straight. The hip flexors have to hold solid isometrically down through the quads, rectus femoris specifically. Both the maximum pull-up and maximum push-up assessments I will do to failure. I like to see how many reps they can do, even if they have to pause, because sometimes there's just a little more in there that they just need that little bit of, they can pause, not dropping, keeping the load on, but they can regroup and continue on. When I get into the maximum sit-up, I will ask them to be able to do this in 1 minute. How many repetitions can they do in 1 minute? The purpose of this is it will force them to keep going. Sometimes they'll do a sit-up and they'll break and they'll breathe, and they'll do a sit-up and they'll break and they'll breathe. I want them to keep pushing the entire time with this, because unlike with the pull-up and the push-up where their load is over top of, with the push-up the load is over top of their hands, or the pull-up the load is on the hands the whole time, the sit-up they are reclining back into a comfortable position. So I want them to keep going. The difference between a sit-up and a crunch, you're simply getting your shoulder blades off the mat. The sit-up, you're looking to get a majority of the thoracic spine off of the mat. And so in doing that, you're engaging more of the core. There's going to be a little bit more to it. It's going to take a little bit more time. Again, in that minute, how many repetitions can they do? Moving into the timed maximum exercises for muscle endurance. A wall sit, I'm looking for the individual to have hips, knees, and ankles at 90 degrees. I want them to dig their toes into the ground, create an artificial arch by pushing from their toes back to their heel, but I want ankles, knees, hips, as I said, all at 90 degrees, and this is a great way to place a person in a position of weakness. A lot of times people don't squat to 90 degrees, so we can work on some range of motion here, but also it's the best way to be able to ensure that your testing metrics are going to be accurate each time. If a person doesn't get down to 90 degrees, what degree are they at? Are you going to measure and make sure that they drop to that exact degree of measurement every single time? Most likely not. So if you just have them go to thighs parallel to the floor, hips at 90, knees at 90, ankles at 90, you're set. You don't need to worry about what degree did they get to and making sure that they get back there. Looking at your maximum plank time, you want a straight line from shoulders to heels. You want spine straight. You don't want any deviations laterally. For this assessment, I will allow individuals to determine whether they want to be in a high plank, meaning on their hands, or in a low plank, meaning on their elbows. The comfortability factor makes them think that they have some sort of a say in the assessment process. However, I will make sure I jot this down, and whatever they do the first time, all future retests, they will end up doing this again. Another reason for giving them a bit of a say is if the person has a prior injury in their shoulder, you never know if a low plank is going to be more comfortable for them or more painful for them. So I like them to be able to decide what is best personally, comfortably for them to be able to actually perform the assessment. And it'll allow me to also determine for my exercise protocol that I will then plan after the assessment how I want them to continue to do the plank when I utilize the plank in the future. Power movements are one that may not always be used, similar to the maximum strength. Not every individual is looking for that explosion, that ultimate strength. Truth be told, a lot of people are looking for weight loss or functional movement and or just maintaining what they have. So when we're looking at power, this is going to be more of your athlete, your performance individual who wants to improve their metrics and grow and develop in some fashion. 3 assessments that we can use: broad jump, meaning horizontal, a vertical jump, pretty straightforward, jumping straight up in the air, and then an overhead medicine ball throw. What we're looking for here, the broad jump, they're going to have feet equal. You're going to have a tape on the floor, and they're going to line their toes up with that. Typically, their feet are going to be about hip width, maybe slightly wider if they end up getting beyond too wide at the hip, or if they're too narrow, they're not going to have really their strength shortening system of the muscles lined up appropriately. But they do get to kind of determine how they want it to be, because then as we move through the metrics, they may be able to find a position that they will find most comfortable and continue to be into that. Their body will naturally place them in a similar position each retest. They're going to drop down and let the ankles, the knees, and the hips all flex. And then they're looking for triple extension. They're going to throw their arms forward, and try and land equally on 2 feet, and you'll measure from where their toes started to where their toes end. You're looking for the total distance. It's not like track where you end up measuring to the heels. Just toes to toes is the easiest way to do it. You can determine the total distance in that fashion. Vertical jump is a little different. Typically, you're going to do it from a standstill. And I say typically, I'll get into what atypical is, although it is common. But typically, again, you're starting from a standstill. You're going to drop down. Ankles, knees, hips will all flex. And then you're looking at rapid muscle contraction, triple extension, driving down into the floor, your ground to reaction force. This is when you would double with a deadlift assessment, because if you're looking to increase the ground reaction force, you will also, in the process, typically be increasing your vertical jump as long as the body weight maintains a similar number. As you're then doing the vertical jump, they're going to either slap a piece of tape up on the wall, or they may have a measurement where the slapstick and however high they can slap the rotating pieces out of the way. You can then measure up to that. In doing so, the broad jump and the vertical jump are very repeatable in both of these fashions from a standstill. You may have track athletes who are going to look at a running broad jump where they have to take off of a platform because it will best mimic a long jump. And for vertical jump, I said that there is the atypical assessment that is not so atypical, and that's going to be for basketball athletes. Athletes who are going for a rebound, they're going to be taking a step or two or running into it a little bit. There will be a designated takeoff point that you have to be within, but having that little bit of momentum moving in, you get a little bit more plant and go. You're increasing the ground reaction force, and they'll get a higher number, which to scouts is going to look better in the combine. The overhead medicine ball throw is one of many throws that can be included in a performance exercise protocol, but it's a great one looking at, again, triple extension from the ankles, knees, and hips. And it also is going to show you some upper body and low back extreme muscle contraction rate. So you're going to start with a medicine ball down on the floor between your legs, and you're actually going to be measuring behind the individual. So you're going to want to be a little bit of a ways away from them, behind them. They're going to drop down, flexing ankles, knees, and hips, grab the ball, and then from that wound up position, they're going to rapidly extend, triple extend, again, the ankles, knees, and hips, but also kind of catapult, bringing their hips into their arms and swinging their arms up and backwards over their head, and trying to launch the ball as far as they can back over their body. The landing point is where the measurement will take place. There is going to be a bit of a pattern. You don't want them to throw too high because then the ball will end up landing short. And same thing if they throw straight back from where they're at. It's going to end up, gravity as a thing, dropping lower than it probably could have. So there is going to be some sort of a balance between this, and it takes practice to get this movement down, especially if you're looking at retests. Your first couple tests may be a little all over the place, but you're looking for a nice, smooth, catapulting motion so the ball can land as far behind the individual as possible. The final thing you want to do after you do the assessment is sit down with the individual, let their heart rate come down, let them settle, let them rest, and discuss SMART goals. Again, for SMART goals, we're looking for them to be specific, measurable, attainable, realistic, and timely. At this point, though, during the consultation, I will say, the individual usually is the one listing their goals, and you may come up with a few SMART goals at that point. The professional can then use those goals to develop the assessment protocol. However, at this time, after the assessment protocol, the professional can use the development of SMART goals and weigh in as a professional and help the individual determine what may be attainable for them, what may be realistic, what a timely manner may actually be compared to what they may think it is. So you're not only looking for present goals, what you're going to do that day to develop a plan moving forward, if they need to make any adjustments for when they go home, when they come in that week, anything to that nature. You're also going to determine short-term goals. The next couple weeks into next couple months, you're looking at what goals you're trying to achieve in a certain amount of time. And then finally, you're looking for long-term goals. What are the units of measurement that you can use to determine your success beyond 1 or 2 or 3 cycles of exercise and through 1 or 2 or 3 retests? Where do you ultimately want to be? How do you get there? What short-term goals need to be put in place to ultimately build on each other and reach those long-term goals? The professional needs to work with the client to create these SMART goals. In summary, while speaking with coworkers at Fitness Together, we discussed how to create and utilize a comprehensive functional assessment with all of our clients. We first want to start by discussing with each client about their general health, going through finding out their resting heart rate, finding out their BMI, in general, their weight and their height, moving through general health metrics in that fashion. We then want to test them for movement mechanics, biomechanical movement patterns, determine if they have any deficits or any deviations that need to be corrected, if there's anything we need to do even before we start an exercise protocol to make sure that our clients are set up to succeed in the best fashion possible. We don't want to waste their time, we don't want to waste our time, and more importantly, we don't want to hurt them. We want to make them better, we want to help them improve and grow. That's why they're coming to us as professionals. So we need to make sure that they are prepared to move in the most mechanically sound way possible. Next, we're going to go through our exercise protocol. All of the assessments will focus on some sort of cardiovascular, strength, muscular endurance, and or power facet. Each of these has specific goals. Each one would be used for different types of clients. Remember, comprehensive does not mean that it's the same for everyone. A comprehensive exam for person A is going to be different from a comprehensive assessment with person B. But there's ways that we can go through each assessment in order to make sure that each individual is assessed to the greatest of our ability and for their best future success. And finally, discussing the future goals. We not only want to discuss their goals prior to the assessment to make sure that we have the appropriate assessments selected for each individual, but also discussing their goals afterwards, weighing in a little more afterwards as a professional as to what is realistic for them to attain in a timely manner. Going back to those SMART goals, we as professionals know what is able to be accomplished. We have seen it, we've done it, we've possibly even gone through it ourselves. We need to be the ones to help guide each individual through their future potential after utilizing a functional assessment. Again, I was afforded this opportunity to teach my coworkers and am willing to do this again in the future. If you have any questions for me, please contact me at wil7881@calu.edu. Thank you for joining me.